What if I told you that a silent killer could be lurking inside you right now, with no symptoms, no warnings, and affecting 1 in every 2 adults? This isn't a plot from a horror movie. It's a real-life condition that could be a ticking time bomb in your body. Stay tuned to find out what it is and how you can know for sure if you have it. That silent killer is high blood pressure, also known as hypertension. But what does that even mean? Imagine your blood moving through your body like water through a hose. Blood pressure is the force of blood pushing against the walls of your blood vessels. When that pressure is consistently too high, it's like turning the water pressure in the hose way up. Over time, this constant force can damage your arteries and lead to very serious health problems. It's called the silent killer for a chillingly simple reason. You can have it for years without feeling a thing. No headaches, no dizziness, no shortness of breath, nothing to alert you that something is wrong. That's why it's so dangerous. While you go about your daily life, unseen damage could be happening to your heart, your brain, your kidneys, and even your eyes. And the statistics are staggering. About half of all adults in America have high blood pressure. So that means the person sitting next to you, a family member, or even you, could be at risk without even knowing it. So, how do you know? The only way is to get it checked. Your doctor uses a simple, painless test with a cuff on your arm. The reading has 2 numbers. A normal reading is less than 120/80. Anything above that is a sign that you need to pay attention. Now that you know what high blood pressure is and why it's so incredibly dangerous, you're probably wondering what causes it. Is it your diet, your genes, that stressful job? We're going to break down the surprising risk factors for high blood pressure. You might be shocked to find out what puts you at risk. Don't forget to like this video, subscribe to our channel, and hit that notification bell. We have already revealed the silent killer, high blood pressure. But who gets it? Is it just something that happens when you get old? You'll be surprised to learn that your daily habits, your family tree, and even your ethnicity can play a huge role. Are you unknowingly rolling the dice with your health? Let's find out. You asked, and we're answering. What are the causes and risk factors for high blood pressure? Some of them you can't change, but many of them you can. First, let's talk about the things you can't control. Age is a big one. As you get older, your risk for high blood pressure increases, especially after age 45. Your family history also matters. If your parents or other close relatives had high blood pressure, you're more likely to get it too. And race plays a part. For example, black people are more likely to develop high blood pressure than people of other races. Now, for the things you can control. Let's start with your diet. A diet high in salt and low in potassium is a major contributor to high blood pressure. Processed foods, fast food, and even some restaurant meals are loaded with sodium. Next up is physical activity. Are you spending more time on the couch than on your feet? A lack of exercise can lead to weight gain, and being overweight or obese is another significant risk factor for hypertension. Then there's lifestyle. Do you smoke? Do you drink too much alcohol? Both of these can raise your blood pressure. And let's not forget stress. While stress itself doesn't directly cause long-term high blood pressure, how you react to it can. If you cope with stress by eating unhealthy food, smoking, or drinking, you're increasing your risk. Finally, certain medications and illegal drugs can also raise your blood pressure. It's always a good idea to talk to your doctor about the potential side effects of any medication you're retaking. So you know what high blood pressure is, and you know the risk factors. What happens if you have it and don't do anything about it? The consequences are far more serious than you might imagine. Now, we're going to uncover the terrifying complications of untreated high blood pressure. From brain-altering strokes to life-threatening aneurysms. Imagine a time bomb silently ticking away inside your body, capable of causing a sudden, catastrophic event at any moment.
Ow.
That's what untreated high blood pressure is like. We've talked about what it is and what causes it, but now we need to talk about what happens when this silent killer strikes. The damage it can do is shocking, and it's a reality for millions. For years, even decades, high blood pressure can be damaging your body without you feeling a thing. But eventually, the damage will reveal itself, and often in a devastating way. Let's start with your heart. The constant high pressure forces your heart to work harder to pump blood. This can cause the heart muscle to thicken and enlarge. An enlarged heart has trouble pumping blood effectively, which can lead to heart failure. High blood pressure can also damage your arteries, making them more susceptible to the buildup of plaque. This can lead to a heart attack. Now let's talk about your brain. The same damage that happens to the arteries in your heart can also happen in your brain. High blood pressure can cause the blood vessels in your brain to burst or clog more easily. This can lead to a stroke, which can cause permanent brain damage, disability, or even death. Another terrifying possibility is an aneurysm. The constant pressure can cause a weak spot in an artery wall to bulge out like a balloon. If that aneurysm bursts, it can be fatal. But the damage doesn't stop there. Your kidneys are filled with tiny blood vessels that filter waste from your blood. High blood pressure can scar your kidneys, preventing them from working properly and leading to kidney failure. And what about your vision? The delicate blood vessels in your eyes can also be damaged by high blood pressure, leading to vision problems and even blindness. This all sounds incredibly scary, and it is. But here's the good news. It doesn't have to be this way. High blood pressure is treatable, and in many cases, preventable. Now, we're going to give you the ultimate guide to taking control of your health. We'll cover everything from diet and exercise to the latest medical treatments that can help you manage your blood pressure and live a long, healthy life. To fight back. Are you ready to discover the powerful, life-changing steps you can take to conquer high blood pressure and reclaim your health? You have the power to make a difference in your blood pressure, and it starts with your lifestyle. Let's talk about the changes you can make right now. The first is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This isn't a complicated, restrictive diet. It's all about eating more fruits, vegetables, and whole grains, and lean protein, while cutting back on salt, sugary drinks, and red meat. Next, get moving. You don't have to become a marathon runner. It's just 30 minutes of moderate exercise, like brisk walking most days of the week, can make a huge difference in your blood pressure and your overall health. If you're carrying extra weight, losing even a small amount can have a big impact. And, as we discussed earlier, if you smoke, it's time to quit. If you drink, try to quit, or do so in moderation. Stress management is also key. Find healthy ways to cope with stress, whether it's through meditation, yoga, hobbies, or spending time with loved ones. For some people, lifestyle changes alone may not be enough. And that's okay. Many safe and effective medications can help you control your blood pressure. These can include diuretics, beta blockers, ACE inhibitors, and others. Your doctor will work with you to find the right medication and dosage for you. The most important thing is to work with your doctor. Get your blood pressure checked regularly, and if it's high, come up with a treatment plan together. We hope you're now armed with the knowledge you need to protect yourself and your loved ones. Remember, this isn't a death sentence. It's a wake-up call. You can take control of your health, and it starts today. If you found this video helpful, please give this video a thumbs up and subscribe to our channel for more health and wellness content. And share this series with someone you care about. It could save their life. Thanks for watching, and we'll see you in the next video.